So let's talk about hypersomnia disorders and their conditions. So hypersomnia disorders are basically conditions where there is severe excessive daytime sleepiness that is occurring chronically. So at least 3 days a week for at least 3 months. Now, when we're talking about the treatment, the American Academy of Sleep Medicine has put out guidelines, most recently revised in 2021, really describing what the approach should be. So first-line therapies typically are going to be your alerting agents or your oxybate therapies. Very commonly, we use those in combination. Second and third line therapies typically are consisting of your traditional stimulants like methylphenidates and amphetamines. So what are alerting agents? Alerting agents are medications that were developed to really work on the brain and help the brain to produce or sustain more of the neurochemicals that keep your brain awake. So examples of that include modafinil, armodafinil, which really are focusing on dopamine in the brain, similar to solriamfetol, which is a newer medication with less systemic side effects. A novel medication that has been available now for the past few years is a medication called pitolisant. This is a medication that actually works on your histamine. It's the only non-controlled substance available that can be treating excessive daytime sleepiness, and those who have narcolepsy also can treat cataplexy. When you're talking about oxybate therapies, there's sodium oxybate and low sodium oxybate. These are medications that you take at night, and they can not only help with excessive daytime sleepiness, and then again, those who have narcolepsy have cataplexy, can help with that, but very frequently also may help with disturbed nocturnal sleep. When you're talking about idiopathic hypersomnia, most of these medications don't necessarily have an FDA-approved indication. Only low sodium oxybate is the only FDA-approved indication. However, there's a ton of medications that are currently being evaluated for FDA clearance. Just because we don't have an FDA approval yet doesn't mean we can't use these medications. Very frequently, we still are using them. But again, one of the things I like to drive home is that if you have a condition called a hypersomnia condition and you are partnering with your provider, make sure you're having your management tailored to what your needs are, and really make sure that you're continuing to reevaluate whether or not that effect is being optimized. As I mentioned earlier, polypharmacy or using more than one medication very frequently is applied. Why? Because it allows us the flexibility to meet your needs and your everyday life. So make sure that you're partnering with your provider and really leading the direction as to what is best for you.